Hello, my name is Mabel Munoz, and the disease I decided to focus on today was lupus, also known as systemic lupus erythematosus. I will be speaking about what lupus is, what the diagnosis is, the signs, the symptoms, and the treatments, along with some sources to back them up. So what is lupus? Lupus is a chronic autoimmune inflammatory disease that is basically the body's allergic to itself, meaning that the immune system attacks its own tissues and organs. This disease causes inflammation in the skin, kidneys, joints, blood cells, brain, lungs, and heart, and affects about 200,000 people in the United States alone. So now I will explain what the symptoms of lupus itself is, along with some signs and the diagnosis of this disease. So the symptoms and signs of lupus varies from person to person depending on their environment, their genetics, their previous health history, and how their lifestyle. So basically, some of the symptoms include fatigues, joint pain, rashes, fevers, pain while breathing, severe pain in the chest, dryness in the mouth and ulcers, along with scaly rashes along the body and face, mainly focusing on a rash along the cheeks and on the face. Along with the signs and symptoms that I mentioned in the previous slide, lupus is very hard to diagnose, being that a lot of people might show some symptoms and some people might not show symptoms at all. And the symptoms that are explained can basically be symptoms from other illnesses that might not be as severe or can be even more severe than lupus. So then again, it's very hard to diagnose, and it's not like there's a particular blood test that one can take and lupus will show up. It's just basically based off medical history and the symptoms that the person is experiencing. And then, being that it's an autoimmune disease, it's possible that a combination of one's genetics and environment, lifestyle, once again, can have a very big impact on whether one gets lupus or not. Now that I have mentioned the signs and the symptoms of lupus, I'm going to go a little bit into the treatments of lupus, being that lupus cannot be cured. As I mentioned before, there isn't a cure for lupus as of yet, but there are some treatments that can care for lupus, such as medications, immunosuppressants, drugs, and steroids. Then there's also self-care, basically applying sunscreen when going out, wearing protective clothing, being that there's a lot of inflammation to the skin with this disease. And then lifestyle modifications, basically going on a strict diet, making sure you're eating well and exercising regularly in order to reduce inflammation in the joints and in the muscles. So while doing my research for this disease itself, I found a lot of research articles and journals about what is new within lupus and the treatment for it. This being one of them, this newspaper article entitled Trial for New Lupus Treatment is called Promising. It's basically introducing a new medication that has arrived for those with lupus that a lot of people have explained to be very promising, and that their symptoms were less severe than when taking other medications, and it's called Benlysta. However, the negative of this medication was that it's much more expensive than old generic immunosuppressant drugs and steroids that are already out there for those with lupus. And I did agree with a lot of what was going on in the article. It was more of a positive note for those with lupus, being that there's more research and experimentation with medications for this disease. However, I would have gone a little more depth into how the trial patients felt before and after being under the treatment, because all that was really explained was that there was improvement, not much on what was improved. That's probably the negative side of this article, but overall it was a pretty good article. So along with articles, I found also a lot of videos and documentaries about people living with lupus. This being one of them, it basically focused on a pre-op nurse, Lanky Alexander, who suffers of lupus and had to explain to her doctors for 2 years that she was not feeling herself. She was feeling very sick all the time, and she basically had to tell the doctors to test her for lupus and basically keep track of her symptoms. And in the video itself, it explains how she lives with this disease and how she tries to overcome it every single day. There are symptoms that flare up from time to time. Her specifically took up rowing. She didn't let the disease stop her from doing what she loves. So it does affect the muscles, but again, she goes through it, pushes through, takes her medications, and didn't let the disease stop her. Also, within the video, it explains how 90% of people with lupus are women and of childbearing age. Uh, Basically focusing on women because being that lupus targets a lot of women. But I would have probably included more statistics on males within the video and explain how, even though there are a low percentage of males with this disease, that they are still at risk for lupus. And I also would have included more testimonials of people with different stages of lupus, being that lupus can range from very mild cases to very severe cases, whereas Alexander herself was more on the mild side and not as severe. So that way it'll target and be relatable to more people instead of just people with the mild cases. Overall, it was a pretty good documentary slash video of those living with lupus. Moving along, another one of my sources that I found while doing this research was a pamphlet, and it's basically the who, what, where, when, and why of lupus, and mainly focusing on women, being that 90% of the people with lupus are women. It also gave some advice, treatments, and information about women that are pregnant with lupus and what their route would be, what their doctors would recommend, and how it's a little different if you are pregnant.